Hi, this is Hannah Rubin, and this is my medication administration video. The first thing I'm going to be doing is I'll come into the room, wash my hands, performing hand hygiene, and then I would go up to the patient and introduce myself. I'm Hannah Rubin. I am a nursing student, and I am going to be administering your medication today. So I would explain the procedure, make sure they're in a comfortable position, see if they have any preferences that I need to be aware of. Do you have any preferences? Okay. And then I would make sure that I have the right patient. So could you please tell me your name and your date of birth?
I am Mrs. Jenkins, and I was born January 7th, 1947.
Okay, perfect. And then I would assess some of the information. So I am going to be administering an anticoagulant. It's called warfarin, Coumadin. So what it does is it helps prevent blood clots. So just some patient teaching that I'm going to tell you. If you experience any abnormal bleeding, I need you to contact me. So like gum bleeding, bleeding when you're like going to the bathroom, anything like that. So just a little caution, you could tonight when you brush your teeth, use a soft toothbrush instead of like a hard bristled one. Do you have any allergies?
No.
No? And from a pain scale from 1 to 10, where do you think you'd rate?
About a 6.
6 right now. I see that you were experiencing nausea last night. Is that still happening?
No.
Any other side effects you're experiencing?
Nope.
Okay. So, with this medication, there are some like dietary restrictions. You might want to avoid caffeine or anything that's caffeinated, so like coffee, sodas, stuff like that. Foods, just kind of avoid, stay away from like high fatty foods and like excessive vitamin K, so like leafy greens, I would just avoid them for now. So after I have taught the patient everything she needs to know about it, I am going to check my medication before I administer it. So we need to do that 3 times. The first time I'm going to get into the cabinet where the medicine is and check it. So it is warfarin Coumadin, 2.5 milligrams by mouth daily, and that matches the order that I have from the physician. And next I am going to remove it from the wrapping and then check it one more time. So it is warfarin Coumadin, 2.5 milligrams by mouth daily, and that is the same as the order. And then I would unwrap it for her and check it one more time before administering. So one more time, it is warfarin Coumadin, 2.5 milligrams by mouth daily, which matches the order from the physician. So Mrs. Jenkins, are you ready to take the medication?
Yes.
I would also provide a cup of water for her. Would you like to take the 2 pills at the same time or separately?
The same time.
Okay, so go ahead whenever you're ready. Let me know if you have any difficulties. Okay? How you feeling?
Good.
Did you have any difficulties swallowing the medication?
Nope.
Did you take all of it?
Mm-hmm.
Okay, perfect. So after that, you would sit her back in whatever position makes her feel the most comfortable, whether that be laying flat or sitting up a little bit. You would lower the bed to the lowest position, raise the side rails, and just like go over it one more time, make sure she's super like as comfortable as she can be. And then I would leave the room and document what I did and the medicine that I administered. So I would write warfarin Coumadin, 2.5 milligrams by mouth at 1800, and I would also sign. And then in about 30 minutes, I would come back to the patient's room and see if they were experiencing any side effects from the drug and making sure they're still comfortable and answering any questions that they have. And that is it. This is Hannah Rubin, and that was my medication administration video.